as a whole, the fundamental level, I think open by default is a power shift. And we're going away from a top-down hierarchical one-way flow of information with offices and parts of HHS being gatekeepers to being more enablers and opening up, breaking down the silos, allowing the data flows to be bi-directional with those feedback loops. And then when you push information out to the front lines, you're also pushing the decision-making power and some of the authorities. And so it is a power shift to those experts in the trenches on the front lines, whether it's local, state, regional, or whatever.
Hello, and welcome to HealthCast. I'm Sylvia Oakland, staff writer with GovCIO Media and Research. The Department of Health and Human Services' new data plan is a modular approach to incorporating real-time feedback. Chief Data Officer Kristen Honey, who you just heard from, said these efforts are helping advance an open-by-default culture in the federal government. Honey said information sharing was often one-way and siloed, but health technology and science at HHS are catching up to the 21st century.
If you look at academia, it's very siloed by discipline. If you look at how HHS and our institutes and centers are set up, we separate hearts and lungs from infectious disease. We just it's very siloed. That's how 20th century science worked and evolved. Now with technology and instant information exchanges, we can reimagine what that looks like. And I think it'll be a time for complex systems thinking and integrating all of this. And we are at this cusp at HHS where I think we have an opportunity to do something like that, and transparency and information and breaking down those silos so that you can see the collective, so you can see the holistic impacts of what are the across the whole society, the whole human body. What are the health and human services impacts there? And that hasn't been done before.
Honey told me that for her, success is enabling those on the front lines to have the information they need to do their job to the best of their ability and when they need it. And this model that's based on feedback loops and incremental changes was successful during the COVID-19 pandemic, and it inspired Honey and her team. How could a model for rapid response be scaled for day-to-day operations during non-emergency moments?
They did this modular approach. So through the COVID response, and it was on the COVID response, was watching this kind of modular way of getting a bunch of experts together, people who all had different elements of a very complex puzzle, and then agreeing to a cadence to refreshing things. And I would argue that approach for living evidence guidelines worked very well, at least in a fast-moving emergency, and it's an opportunity to reimagine how clinical medical guidelines might work and other fast-moving things where you want to take the latest science, the latest understanding, and then update, the recommendations, the approach, with that input and continuous feedback loops. So that was sort of the inspiration, is watching how medicine adapted during the COVID response. And I thought, why can't we do that for, the open data plan, and then use the public expertise
rather than a static PDF on HHS's website that is updated throughout the years. The plan is broken into chapters or themes into a GitHub module. And Honey told me that partners are able to comment on this module, which will help HHS receive that feedback quicker and make those updates sooner.
Just thought, can we use that really captive audience who cares so much about open data, so much about turning the data into understanding and insights to make better policy, inform action, fuel their business models, going into student projects, professors' trainings and curriculum. And so it has a very captive audience, and just thought, can we emulate what happened with living evidence guidelines in a clinical setting in this technology space, and then open that up for all the experts out there, even if they're not inside, government, to give us feedback of what's working, what's not, what they would like to see. And then through that really distributed front lines and type feedback loops, we will hopefully improve faster together. We did pilot little things like this in the COVID response with hospital data. If you remember when we published open data on hospital facility information. and it was averaged by week. We put out a call to action saying to the public, we know this data isn't perfect, but we're not going to let perfect be the enemy of good. So please give us your input. We're listening. We want to respond. And with your feedback, together, we can improve the data quality. And your input will help us prioritize what other data sets and types of information HHS should be prioritizing and unlocking for the public.
This push for transparency has also given momentum to create stronger partnerships between HHS and its partners at every level. During the first Trump administration, CDOs across government met publicly throughout the year to show how agencies were doing data. Honey said something like this, an open forum for the public to observe, spurs innovation with partners, big, small, and everywhere in between. And she hopes to see more collaboration like this as open by default becomes that cultural norm.
And I think there's a lot of momentum in that space from both lightweight collaborations to the formal public-private partnerships, because when you do that right and you marry different groups together, then you can use the strengths of government and HHS to be an authoritative body and to be the authoritative data standards and data governance bodies in this space. But there are trade-offs. Even though it's authoritative and people will listen to it and respond to it, we don't move at the pace of industry. We don't move as fast as other sectors. We're often not the cutting edge of how standards are being implemented and used. So that understanding of where standards need to evolve and open data kind of needs to update it, whether it's standards or whether it's unlocking more information in sectors that are priority. The front lines in other sectors are often the data users, not us inside. So when you marry those sectors, then we can take the strengths and move faster at the pace of external industry with, the cutting edge of entrepreneurs and academics using the data in tip of the spear applications, but with the authoritativeness of HHS.
Collaborations are also important to help the open data team provide a better user experience. HHS is a large organization that has petabytes of data, and users might not know where the data they need lives. The refreshed data plan is accompanied by the new HealthData.gov, and it offers a one-stop shop for public health data.
We're a bit like a concierge, and I think the more high tech we become with data and AI and emerging technologies, the more high touch we should be. So where our small office is going is to really try to leverage AI and technology so that contact us and concierge backend, we can automate as much of it as possible so that there will be humans in the loop directing it and all that. But if someone's asking a disease prevention and control question, probably that's CDC. And, the AI and technology really helped us a ton in the COVID response to route call centers and help desk and hiring. When we were hiring for the emergency prepares, lots of different, roles, same thing with help desks and questions, lots of different questions. And so that first layer of where to route it appropriately can really benefit and make the responsiveness much more customized, much more rapid, and get it to the right people for that human response really quickly. So what we're hoping to do with our small team is keep the human-centered design front and center, put ourselves in the seat of who are our users. And then from that, how do we make it one-stop shopping super easy for them? The challenge for us on a small team is, that's not scalable if it's all manual. So that's where the power of AI and emerging tools will really help us. Excited to improve it with every iteration.
HHS Deputy Secretary Jim O'Neill has tasked the agency with rolling out an updated version of the plan by November 2025. And HHS will determine the cadence of updating the plan as they receive feedback. Thanks for listening to this episode of HealthCast. Be sure to join us for our Health IT Summit on September 23rd, where you'll be able to hear more about the open by default culture, AI, and more from our top health officials who are joining us, like ASTP's Stephen Posnack and CMS's Patrick Newbold. Register and see the full lineup of speakers at www.govciomedia.com/events.